Hi, my name is Mystical Evans, and I am going to be reviewing the case of Katie Martin today using the SNAPS approach to clinical education. The first step is to summarize. Our patient Katie Martin presents to the clinic today as a new patient for a wellness exam. The patient says she's typically in good health and she does have a full-time job waitressing. However, I am concerned because she states that she has missed a lot of work lately for personal reasons, which she does not elaborate on. The patient lives with her boyfriend of 6 months who works full-time at a car wash. She's up to date on her pap smear and GYN visits. Her only medication includes taking birth control. She does state that her and her boyfriend argue often about money, and she often feels forced to have sex with her boyfriend when she does not want to. She reports her boyfriend doesn't let her communicate or spend time with her friends or family unless he's there. He also tends to become mean when he drinks, which he does on a daily basis. Katie does report that she is a current smoker. She uses this to help deal with stress. She reports a diet that consists mainly of junk food and a 24-hour diet recall, and she does not exercise. Her last menstrual cycle was approximately 2 weeks ago. She has no pregnancies. She is up to date on vaccines, sleeps approximately 7 hours a night. Her mother, father, and brother are all alive and well. She does have a family history of alcoholism in her father. She's not able to contact her family often, so has limited support from her family. She reports she has no thoughts of self-harm. She denies any recent health changes or weight changes and has no complaints today. Some objective findings include a blood pressure of 120/80, heart rate of 80, respiratory rate of 20, and temperature of 98.6. Her Beck depression scale done in the office was negative for depression, and there were no abnormalities in the blood work done in her office visit. X-rays showed no obvious signs of physical abuse. The patient does appear thin, but is appropriate and answers questions appropriately. Her skin is warm and dry. There are no obvious signs of old or new bruises on the patient. Her HHENT assessment shows that there's no obvious trauma noted, and her thyroid is not enlarged. Her lungs are clear and equal bilaterally, S1 and S2 heart sounds were noted upon auscultation. She does have poor eye contact during communication. Her deep tendon reflexes were 2+, and she shows no signs of abuse, trauma, swelling, or bruising in her upper and lower extremities. The next step in the SNAPS criteria is to narrow your diagnosis based on the subjective and objective findings just discussed. My 3 differential diagnoses for Katie would be depression, domestic violence, and nutrition deficiency. The third thing is to analyze those. I believe at this time, based on current findings, that Katie is most affected by domestic abuse, and that would be the highest diagnosis on my list. While there are no signs of physical trauma with the patient, she does show objective signs of this, such as avoidance of eye contact and appearing thin. She does report being forced into having sexual relationships with her boyfriend when she doesn't want to. Her boyfriend interferes with her personal relationships with her friends and family. She's not allowed to hang out with her friends unless he's there. She also reports the desire to go to college, but her boyfriend does not support this idea, and he does become mean when he drinks, which he does daily. Recently has been showing up to work to check on her during the day. He refuses to help with the household chores because he considers them to be women's work. And Katie does deny being physically hit or abused by her boyfriend, but does report that her friends are afraid of her boyfriend. All of this information is concerning for domestic violence affecting Katie's daily life. The next diagnosis I would consider would be depression. The fact that the patient avoids eye contact could be a sign that she is depressed. Another common sign of depression is missing activities, and she does report missing several days of work lately for personal reasons. She's also isolated from her friends and family, which could be a contribution to a depression diagnosis. She does live with her boyfriend, but he provides little to no support emotionally and mentally to the patient. She's considered a victim of domestic violence, and this can also contribute to a depression diagnosis. She does not report any negative changes to her sleep patterns and does average 7 hours of sleep a night. She denies suicidal ideation and has a negative depression screening in the office, making this less likely than domestic violence for Katie. The last diagnosis that I would look into that could be applied to Katie would be nutritional deficiency. In a 24-hour recall, she does admit to having a diet made up mostly of junk food and fast food. She reports drinking coffee, Mountain Dew, and Coke. Her 24-hour food recall included a roast beef sandwich, a fast food burrito, and chips. Katie, however, is not overweight and actually does appear thin. She shows no objective signs that her imbalanced nutrition is impacting her, but this could create issues for her health in the future. This is the least likely diagnosis for Katie, but would be a good opportunity to discuss the importance of a well-balanced diet and exercise with her. The next part of the SNAPS criteria is probing the preceptor. So talking through the diagnoses that are options for Katie, one of my biggest questions is if domestic violence is an appropriate diagnosis or if this should be narrowed down into something more specific when assessing a domestic violence situation. I did narrow my diagnosis down to the top 3 I would look at, but Katie does also report smoking cigarettes. Therefore, another potential diagnosis could be substance abuse, which may be a better one to use over nutritional deficiency. But at this time, I don't think it's her most concerning problem. And in her current situation, it may not be an opportune time for Katie to try and quit smoking. So based off the next step is plan. And based off the main diagnosis I chose for Katie, I believe my initial plan for her would be to gather as much information as possible about her current interactions with her boyfriend. She's been very forthcoming with information so far and honest, but I would try and ask what her personal reasons for missing work could be. I would not push her to answer questions she was not comfortable answering. I would make sure that she understands she's not alone, that she could reach out to me anytime and she will be supported. One important task I would do prior to letting Katie leave is to assess for if she's in any immediate danger, and if she were, the police might need to be contacted in that situation. If not, I would make sure that Katie has a contact person that she can call if she feels the need to or the need to leave her house. And it's important to give her a list of hotlines that are available 24/7 and a list of any women's shelters that are in her area in case she were need to leave home. And lastly, I would make Katie a follow-up appointment to return in 1 month. At that time, she may feel even more inclined to open up a little more, and it would be a good opportunity to see if there's any new signs of physical abuse or violence in her relationship that would be concerning. I would give her information while she's in the office about a proper diet and exercise, as this could be beneficial to her health. And I would provide her information about smoking cessation. It's important for her to quit smoking for her health, but this feeling of quitting may be overwhelming to Katie if the issue is pushed, and I would fear if it was pushed too much, she may not return to the clinic. So this smoking cessation would be a goal she could work on over time. The last part of the SNAPS criteria is to select a case-related issue. So in this particular case, I would like to do more research into the legal actions that would need to be taken if somebody came into the clinic in a current physically violent situation. I know each facility most likely has its own policies and procedures of what to do if this occurs, but from a provider standpoint, I would like to know what is expected of me, what documentation would be required, would I need to document photo evidence for a case, is there a standard body map that I would draw injuries on. I would also like to know what my role is in a domestic situation if the police were to need to be contacted. Also, more research on my end is needed so I can better determine key signs of domestic violence versus depression. I believe these two things are very similar in their symptoms, and I would need to study the differences so I can pick up on information if the patient's not forthcoming about their situation. I would also like to research x-ray images more to better determine old and healing fractures and what they look like, as this could be an indication of domestic partner violence. And being able to recognize those on x-ray from a provider standpoint would be beneficial in my practice. So thank you for listening to my SNAPS criteria, and please let me know your thoughts also.